Okay, so we're going to talk a little bit about the theory of how pain messages are transmitted up the spinal cord to the brain. Now, we know that there was a theory from the 1960s from a couple of researchers called Melzack and Wall. It's called the pain gate theory. And the theory is that there's gates in the spinal cord that can be open, like all these ones are, or we can close the gates. Now, if I was to close one of these gates here, then these pain messages wouldn't end up getting up to the brain. And similarly, if I was to close another gate here, these pain messages wouldn't get up to the brain. And of course, if less pain messages are being sent up, then you're actually going to perceive the pain less. So what can we actually do to reduce some of these pain messages getting up to the brain? Well, we know there's three things out there that can be effective. The first thing is medication. Now, lots of medications are designed to reduce symptoms. They're not a panacea, they're not going to cure all of your pain. However, they can be effective at reducing the intensity, and we will talk about medication as a topic further on in the course. One of the other things we know that can work well is a chemical that the body releases called an endorphin. So anything that's endo is within the body, and anything that's orphin is morphine. It's our own natural painkiller. And we get these endorphins released when we do things like exercise. The chemical can block some of these synapses in the spine that allow pain messages up to the brain. The third thing that we know that can help is relaxation, distraction, counter-stimulation. So this is the example of when you bang your elbow, you rub it and it feels less sore. But also if we can think about our breathing or other things that are happening, then we're going to notice our pain less. And this is how things like mindfulness work. And we'll be talking about that as part of the course.